Acupuncture is my life. AcupunctureIsMyLife. Let us begin.
Hello everyone, and welcome back to my show. Now, today's interesting case of the week is chest painful obstruction, which is known as Xiong in Chinese medicine. Now, the definition of Bi in Chinese means closure, shutting down, or obstruction. So diseases in Western medicine that are similar to chest painful obstruction, or Xiong in Chinese medicine, are angina pectoris, myocardial infarction, coronary artery disease, ischemic heart disease, rheumatic heart disease, bronchitis, pneumonia, pleurisy, pulmonary emphysema, and intercostal neuralgia. Now, chest painful obstruction, or we can just simply say chest B, refers to a group of symptoms caused by obstruction of qi and blood in the chest. Now, chest painful obstruction syndrome is characterized by chest depression and stabbing pain that radiates to the left upper back, shoulder, and down the arm. Now, there are sometimes respiratory symptoms associated as well, as such as shortness of breath, dyspnea, or difficulty breathing when lying down. Now, there can be a stuffy sensation in the chest and difficulty breathing as well, which is usually present in mild cases. Whereas sharp, crushing cardiac pain radiating through the entire thoracic cavity to the back is found in severe cases. Now, there are generally 4 etiology and pathogenesis related to chest painful obstruction. Now, one is invasion by external cold pathogenic factors. Exterior cold can directly invade the chest and obstruct the circulation of yang qi. And pre-existing yang deficiency, especially of the chest, creates susceptibility to exterior cold. Now, when cold accumulates in the chest and yang qi is deficient, the conjunction leads to an inadequate warming and circulation of qi and blood. Now, the result is qi and blood stagnation, causing obstruction in the chest, and there you have it, chest pain. Now, 2, improper diet. Too much greasy or raw and cold foods obstruct the function of the spleen and stomach. In this case, when water is not transformed and transported in the body fluids, it tends to form phlegm within the body. And phlegm tends to block the circulation of qi and blood in the channels and cause chest pain. Now, 3 is emotional stress. Now, I've done several episodes on emotional stress, and I can't emphasize enough that stress tends to wreak havoc on the body. In Chinese medicine, the spleen is susceptible to worry and pensiveness. Now, these are emotional factors that can weaken the spleen. And when dealing with excessive amounts of exposure to these emotional factors, qi and blood cannot be generated because the spleen has become weak. Now, in this case, insufficient qi can no longer facilitate circulation of the blood, and deficient blood would then fail to properly nourish the heart, leading to chest pain as well. Now, in addition to that, anger and frustration can affect the liver and cause the liver to stagnate, whereby stagnant qi leads to blood stasis, resulting in chest pain. Now, in my interesting case of the week was as a result of turbid phlegm accumulation, which caused oppressive chest pain with a sensation of suffocation. Also, the pain radiated through the left shoulder and down the left arm. Now, of course, I had to be sure that he'd either been to the emergency room or had seen his cardiologist and or primary care physician. He was obese, and shortness of breath was a constant reality for him. He had a rattling sound to his speak and would constantly cough up lots of mucus. As I note, copious sputum was emphasized in this case, and his tongue was white with a greasy coating, and his pulse was slippery. I knew I had to unblock the obstruction of yang qi and resolve the phlegm, so my point prescription was Tanzong, Ju Cui, Shi Men, Taiyuan, Feng Long, and now I've only treated him twice thus far. But as his sessions continue, I will keep you updated as to his progress. But there you have it, my interesting case of the week. Now don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?